report on this computer. Okay, this is Rhonda Thomas, and we are getting ready to do Personal Finance Chapter 11's static problems. Okay, so I'm sharing my screen now, so you should see the static problems. We have 12. This is about health insurance, disability insurance. I would say of all the insurances in your life, health insurance is going to be the most complicated. Yep. I used to know health insurance pretty good. I've had some jobs that I've worked in that area, but today I would have to go back and learn a lot. Okay, so let's look at this. It says if per capita, you say, what's per capita? That's per person. Per capita is per person whenever you see that in a problem. If per capita spending on healthcare was about $10,000 a year, and this amount increased by 5% a year, so inflation is going to be 5% a year, what would the amount be per capita in 10 years? So when you think about spending $10,000 today on your healthcare, if that increased 5% each year over 10 years, what would that new per capita be? So I'm going to plug in the $10,000 as present value. Put a 0 for your payment. We're looking for the future value. We have an inflation rate of 5%, and we're looking at it for 10 years. Okay, so I'm going to go get the table. Okay, and this is going to be solving for the future value of one amount. So that's that very first table, future value of $1. Okay, and I'll put, this is table A, future value of $1. Ooh, there we go. All right, so we want 5% in 10 years, 1.629. So I do have the right factor there. So what buys $10,000 worth of health care now, if the inflation is 5% a year, will actually cost $16,290. Now let me plug this into here. All right, so $10,000 is today's money. We're looking for the future value, 5% in 10 years. About $16,288.95. That pretty close? Yeah, within $1 or $2. Sure. So that's good. And I'm going to see if it accepts both. I'm using the table. Okay, so hopefully you guys are using the calculator. Uh-oh. Uh-oh. Let me see. Now, it didn't accept my table. And did it accept your calculator?
Yeah.
Yes. Thank you. I like knowing this. So now let me put in what I got from the calculator. And it's supposed to accept either or. And it irritates me when it doesn't. Got to report it. And sometimes I wonder how we have personal finance gurus making books that don't check their solutions. Anyway, all right, good enough, right? So there you have it. So that's why all the seniors get upset when healthcare costs go up, because guess what? You usually need more healthcare the older that you get, right? Yeah, because you have more things going on. So when it goes up, then especially people that are on a fixed income, that their income doesn't change, it's very difficult to manage healthcare expenses. Okay, number 2, let's talk about a certain policy. So the Keller family has health insurance that pays 80% of out-of-hospital expenses after a $1,100 deductible per person. If one family member has doctor and prescription medical expenses of $2,200, what amount would the insurance company pay on that claim? All right, so let me see if I've got everything. The deductible per person is $1,100. Okay. We get 80% of out-of-hospital expense after that deductible. So that deductible has changed based on last time. So it's increased. So they've got to pay $1,100 before their insurance kicks in. Okay. We had one family expense of $2,200. Let me subtract the new deductible first. So $1,100. Okay. And that leaves $1,100 that the insurance company will then pay 80%. That co-insurance is paid by the insurance company. Okay, paid by the insurance company. So of this, they'll pay $880. Well, the whole claim is $2,200. So if they happen to ask, okay, I want to make sure this is right. Nope, it isn't. So now I'm going to take this amount and subtract what the insurance company will pay. There's the out-of-pocket for the family. Now, they didn't ask for that, but I think there's a couple in here where we have to put down both amounts. And both amounts should add up to the total claim, right? Total claim. So this is just the insurance part of the claim, right? Once you meet your deductible, however, and usually it's for the year. Usually deductibles are for a year, not per event, thankfully. Okay, yeah. So once your deductible is met, you'll hear people talk about having medical procedures this time of year because a lot of times their deductible has been met by the time the year end is about to roll around. So everybody and their brother is in there getting their, if it's not an emergency, get something done so that they don't have as much out of pocket. Let me see if I got this figured right. Okay, $880 because they had that deductible and then they had the 20%. So one more time, the deductible, the out of pocket is the deductible plus the 20% copay. I remember a time that, or co-insurance. I remember a time my insurance company paid everything. Didn't have to pay a copay. I didn't have to pay any co-insurance. I didn't even have a deductible. That was the good old days. Yeah. Well, it's not that way now. So because insurance cost, do you know, and let me tell you something about healthcare, just a little bit from an accounting point of view. Here's the thing. Everybody listening, including you, Gavin?
What's up?
Just listen a minute. You might learn something. If you go get something done up here at Susan B. Allen, something happens today, you break your leg, right? Heaven forbid. You go up here, Susan B. Allen treats you. You don't have insurance coverage. They're still going to treat you anyway because they're supposed to take care of people, right? So if your bill ends up costing to fix your leg, now this is probably low. If it costs $5,000 to fix your leg, right? And you don't have health care and can't pay it, they'll write that off. Or if you do have health care, most medical businesses, for every dollar that they have out that's owed to them, they can only expect 50 cents of every dollar. Everybody listening? Yep. So every dollar's worth of revenue that they have earned, honestly earned, they can only expect to receive about 50% of that. That's not good. There's not very many other businesses that would stay alive because of those statistics. Are you with me? So just that one alone, right? If this was truly how much, okay, if this is the medical bill, right? If this is the medical bill, And this is the expectation from the medical industry that they only receive about 50% of every dollar of receivables. That's why, so that's why they jack up the price, by the way. If you're only gonna get 50% of every dollar, what are you gonna do? You're gonna jack up that medical bill. You better believe it so that you can at least get something in to pay all the different people and things that went on fixing your leg. So I'm just trying to help. I didn't know that kind of stuff when I was your age, okay? So anyway, that's kind of where we're at with the medical industry. It's a completely different beast than all other businesses, okay? Because other businesses would have gone out of business without with those kinds of receivable statistics. All right, number 3, last thing. Okay, off the soapbox. A health insurance policy pays 65% of physical therapy costs after a $200 deductible. In contrast, you can have a policy that's called an HMO. HMO stands for Health Managed Organization, I think. I'd have to look up the acronym. It's been a while since I've messed with an HMO. But an HMO is usually pretty reasonable economically, but they usually limit you to who you can go to, okay? You have to get permission or a referral through an HMO. And HMOs were really popular when I was a younger person, but now they're not as popular because they're pretty restrictive as to who you can go to. So if you're gonna go get physical therapy, let's get started. We've got a $200 deductible. Okay, this is traditional coverage. $200 deductible that covers 65% of physical therapy costs. But the HMO, right? In contrast, okay, so this is this one. This is the traditional coverage. Okay, this is the traditional coverage. This is the HMO. So let's do the traditional first, okay? All right, so here's how it works. Here's your deductible. Here's the policy. And then here's how much your physical therapy sessions cost. They're $50 each. If you do 10 sessions, you're going to have a total bill of $500 for your physical therapy sessions. We deduct the $200 deductible, which then leaves us with $300 remaining. We take 65% of that. So 65% of that medical bill will be paid. So insurance is going to pay $195. And because of the deductible and the other 35%, the patient will pay out of pocket $35. But what they want is, what is the savings between the two policies? So now let's do the HMO. The HMO is simply a copay. Every time you go to PT, you give them 20 bucks. And then that's it. You don't owe anymore. That HMO didn't say anything about a deductible, so we don't know anything more than what they tell us. So the $20 copay exists for the HMO. If you go 10 times, that's $200 to the insured or the patient, okay? So if you, out of pocket for the traditional, you would have paid $305, if I've got my figures right. Okay, I'm gonna make sure. Would have paid $305 because that would have included the $200 deductible and then the 35%, because this is what insurance will pay. Then you have to pay the rest. So by having the HMO, I think you save $105, $105. But that's if you like the physical therapist that the HMO is requiring you to go to. You can't pick and choose who you go to, I guess. So we're gonna compare policies in one here in just a few minutes that is a little overwhelming, but I'll help you get through it. Okay, so I think we're saving $105. Are we right? Yes. So once again, this is the traditional coverage and running those numbers through it. This is the HMO coverage. Okay, let's go to number 4. Okay, number 4. All right. Sarah's got medical insurance that has a deductible of $1,500. Let me put $1,500 down for the deductible. The co-insurance is 80%. 80%, so I've got to change my number there. 80% after the deductible is paid. There's something called a stop loss feature. It's supposed to stop at a certain point when you've paid quite a bit, so you're not bankrupt from medical costs, okay? So it says while on a hiking trip, she needed medical treatment. I'm trying to sum it up here. Her medical treatment ended up costing $9,983. So let's put in $9,983. Let's subtract that deductible. Okay, so we're going to work. This is called working a healthcare cost through the system, right? $9,983. $9,983. Her deductible is $1,500. Okay, that leaves $8,483. The co-insurance, which is what the company will pay, is 80%. So I've got to change that number. Okay, 80%. So from this bill, the insurance company will pay $7,210.55. Her out of pocket is, and by the way, these two numbers must add up to that. Now I've got to do 80%. Excuse me, just a minute. Hang on just a second. 80%. There's where things are different than the last time I did this. Okay, got to put the different factors in. Okay. So once again, here's how much the insurance company pays. These two numbers must add up to the total bill. Here's how you know. In Excel, you can just highlight two numbers, and down at the bottom, you'll see how much the sum is. So you don't even have to put in a formula. So it says $9,983. Yes, that's the total bill accounted for. So there's a stop loss feature of $4,000. Okay, $4,000. But in this case, our bill didn't reach $4,000. It only reached almost $3,200. If this bill would have gone past $4,000, it would have helped. Okay, that stop loss feature means that you don't have to pay any more out of pocket after $4,000. Okay, so in this particular instance, that stop loss feature did not make a difference because the out-of-pocket amount from the patient didn't reach that stop. Okay, so determine which policy would have cost Sarah less and by how much. There is no difference. Okay, there is no difference because she didn't reach that. Okay, so I think the different amount is 0 is what they want. Okay, it's what they want. So having that stop loss feature would not have mattered in that particular incident. She would have gotten injured more and had more done possibly. Okay, so stop loss features are good, but they don't always help. If she had one that was a $3,000, then she wouldn't have to pay the $196.60, right? So that stop loss feature is the limit she'll have to pay. All right, onward we go to number 5. Number 5, this is about disability insurance. Okay, disability insurance. So if you become disabled, we were just talking about disabled as a minority, but if you can't work, if you can't do your job, you can have some insurance that will get you by for a little while to see if you're gonna have a permanent disability. And if you end up having a permanent disability, then you might qualify for Social Security payments under disability, okay? But, so I have a policy, my husband has a policy, that if he becomes disabled, or if I become disabled, disability insurance will kick in and pay us a certain amount a week. Okay, so Georgia is a widow. She has take-home pay of $600 a week. And the disability amount that you receive is based on your weekly income. Most disability only pays about 70%. In this case, her policy pays 65% of her weekly income. All right, so let me put this number in. So she is getting $600 a week from her part-time job. Her disability insurance pays 65% of her weekly pay. Okay, so if she gets sick, and we want this times 0.65. Okay, so she's going to get $390 a week, but she has a waiting period, which happens. She has to wait 4 weeks before that pay will start rolling in. What amount would she receive in disability benefits if an illness kept her off work for 16 weeks? So if she's off for 16 weeks, she has a waiting period of 4, she'll get 12 weeks of pay. She will get 12 weeks of pay. So I've got whatever's sitting here in this cell, which is the 65% of her weekly pay, times 12. It looks like over those 12 weeks, she'll get about $4,680. Okay, so that's better than nothing. And by the way, you don't qualify for unemployment when you get hurt. Okay, you really aren't supposed to apply for unemployment if you're hurt. You're supposed to be able to work. I know we're not really talking about unemployment, but so disability policy could be very helpful, especially, but she's a widow. I don't know if she's got children or not, but anyway, that's what disability is. It's pay that can come in when you are unable to work because of a disability. All right, so 4,680, is that right? I think so. If I followed it through right. Okay. I keep losing my size of this to read, and it's driving me crazy. Wish that it would just stay. All right, let's go to the next one. Number 6. Number 6 talks about, instead of an HMO, we are using what's called a PPO. It's a preferred physician organization. So Stephanie was injured in a car accident, went to the emergency room. Her plan for her emergency room with a network hospital. So the hospital has to be in the network. That's another thing you got to know. Is the provider or the hospital in the network? If it's not in the network, it usually costs you more. If it's, they call it network and out of network. All right, so she has a $500 deductible, and then it'll pay 80%. So I got to change my deductible to $500 from the last time. Okay, $500 deductible. Oop, not that much. Ooh. There we are. Our ER bill is $2,100. $2,100 is the ER bill. Now we want to subtract the deductible. And this is where they want both sides. They want both sides of who's paying what, right? So when we deduct the $500 deductible, we get $1,600. The insurance then will pay 80%, and then the insured will pay the rest. Okay, so be careful. The insurance payment is B. Let's go ahead and put B in first. So insurance is going to pay 80% after the deductible has been met. They're going to pay $1,280. Okay, when you get both, then once again, these numbers must add up to the entire bill. Okay, must add up to the entire bill. So let's put the rest of that in there. So out of pocket to Stephanie, this is called insured costs. That's the person that's insured has to pay. This is the insurance company paying. You have to watch their wording a little bit. Now let's just for fun, let's see if I'm right before I start yakking. Okay. Just for fun, let's say they've already met their deductible. Okay. Let's say it was later in the year when this happened. So that ER bill is actually $2,100 and insurance would pay $1,680, if I've got that right, at 80%. So once again, it kind of matters whether you've met your deductible for the year when things happen, how much is going to be out of pocket. Okay, here comes the hardest problem of the whole year. You ready? Are you ready? Have you done this one?
I'm doing it with you.
Oh, you are?
Yeah.
I don't think so.
Call me a liar?
Well, no.
No, because.
Because what? Okay. I know it's not fun to have to figure all this out, or you can watch it on video because I'm doing it now. Here's what you need to know. I wish they would have done this differently. So I'm going to help you. Here's what it is. Let me just give you it let me give you the AI version.
Do 7 and 8 go together?
7 and 8 go together. Yes.
Great.
So here's the deal. This is a person who started a new job. When you get to a new job, you oftentimes have choices about what healthcare plan you're going to use. We've got 3 of them. We've got a Blue Cross plan, an HMO plan, and it's funny that they use these initials because that's used for another thing. But there's another plan. It's called a POS plan. Before we go into that, let's go here. Okay? You don't pick a benefit plan until you know what kind of health you have. Okay? So we're going to go by history of what Riley's medical bills were from the previous year. Here's what I want you to do. I want you to make a little section in your notes that says previous year's medical costs. This is the hardest. I think it's the hardest problem all year or all semester. Okay. So I had to come up with a plan to try to attack this. So let's see. And we're gonna do the same numbers this time, but when we do this, if we do this for the exam review, you're gonna get your own set of numbers and you're gonna understand that there's more to it. All right, the first thing, help me know. He went to the doctor how many times? 4 times. So yes, 4 visits. How much did they cost? They cost $150. So I need to fix that. So healthcare visits for $150, right, is going to be $600. Do you agree with that? Okay. 4 times 150 is $600. So last year he spent $600 in doctor visits. He only had 2 prescriptions. My gosh, he's healthy. Okay. He had 2 prescriptions that cost him $75 and $89. We need to know those costs. Okay. So 75 plus 89. How much is that? 75 plus 89 is, let me make sure I got it, $164. Here is the total annual cost of last year. Okay, now, no, that's not what they're asking. Okay, what they want to know now is if he picks this Blue Cross and Blue Shield plan, what will be his annual cost? So are you ready now? Okay. So I put Blue Cross and Blue Shield. Now let's find the particulars. When you have health insurance, most of the time you help pay for the premium of it. So in this case, his Blue Cross and Blue Shield plan has a premium of $62 a month. So I'm going to put $62 a month here times 12. His annual premium will cost him this much out of his pocket. So they'll pull it out of his paycheck. So he's going to pay $744 just to have the insurance be active, right? Just to activate this Blue Cross and Blue Shield. For all the doctor visits, the employee is responsible for what? 20%. The insurance company will pay 80% after the what? After the deductible. So now let's put that annual deductible in, which is $800. Okay, so we're gonna pretend like he has the same health problem this year as he did last year. You know that's not always the case. Okay, that's not always the case. So 20% of medical charges after the deductible. His deductible is $600. So I've got to change that. His total health care from last year is $764. Okay, where am I? Yes, $764. That's why we calculated it. If he has that same scenario, that's all he has to go by. $764 minus $600.
The deductible says 800 on
It does say 800. Let me fix it. Thank you. I was looking up here. Thank you. 800. Appreciate that. Okay. So whatever he had done last year, he wouldn't have he would have had to pay the $800. He would have, his deductible is higher than the healthcare cost he had the year before. Okay, so now let me calculate this where it goes. So let me put this in. So this is going to be 0 here, just a minute, because he hasn't met his deductible, right? How much are his medical costs from last year? $764. What is his deductible? So he's not going to get any help from that 80%, not on this bill. Okay, bills after it, maybe. Okay, if he ends up having more healthcare costs than he had last year. So what I got to do is put this in. So if I put 764 and subtract 800, okay, it's probably going to give us a negative number. Yes. Okay, so this should add up all of this. So this is just going to be 0. It's not going to go the other way. So just put 0 in there. So if he uses Blue Cross Blue Shield, let's see if I got it. I hope it's right. 1544 is what I've got if he has the Blue Cross plan. If he has the same medical problems as last year, because that's all he has to go by. Okay, let's see if we're right. Oh, we're not, of course. Okay, so this is a whole new problem. Let me see what I got here. I may have to stop here today. I think we will. We'll stop here. Stop. Okay, I had this all figured out, but then they changed a bunch of stuff. Let me go back through it so I don't confuse you and I don't confuse myself. Okay, so
Friday.
what now?
I'm still writing all the problems.
Are you still? Okay, that's okay. Just let it, if you want to stay, I'm gonna go ahead and see if I can't figure this out. If you want to go ahead and go, I'll pick back up with this one on Tuesday. Okay? So I'm gonna give you the choice. And now I'm gonna go look and see what I missed and what's going on. But okay, so oh, I see it. No, I don't. No, I don't. Okay. 764 is the medical costs. If we had a lower deductible, we'd have something left over to take times 20%, but we don't. Okay, and this problem may not be answering correctly. I don't know. I just haven't investigated enough to even know. All right, guys, so I'm going to stop my video recording now.